In this video, we'll be discussing a topic common to many people who end up at the doctor's office for relief, the headache that comes from the neck. These type of headaches are known as cervicogenic headaches. The problem of cervicogenic headaches is widespread and costs the U.S. healthcare system tens of millions of dollars per year. Patients often get shuffled through a cycle of prescription medications, imaging, and other more invasive medical procedures, all in hopes of finding a relief from this potentially chronic condition. But there's an approach to treating cervicogenic headaches that is conservative, non-invasive, low risk, and has demonstrated a high probability of success, and one that many physicians may overlook. Physical therapy. In this video, you'll learn more about how a cervicogenic headache is diagnosed, how costly it can be, what some of the research says about physical therapy treatments, and how you can benefit. Let's get started. The formal definition of cervicogenic headache is a headache arising from the musculoskeletal disorders of the cervical spine. If you are diagnosed with cervicogenic headaches, then you are not alone. Prevalence of cervicogenic headaches is estimated to be as high as 18% in the general population. In chronic pain sufferers, 1 out of 3 report experiencing a cervicogenic headache, and cervicogenic headaches account for up to 14% of all headache disorders. We can understand the pathology better by examining how the nerves supplying the upper neck also supply the skin overlying the head, forehead, jawline, back of the eyes, and ears. As a result, pain arising from structures of the upper neck may refer pain to any of these regions, causing a cervicogenic headache. Some of the main symptoms associated with cervicogenic headaches include neck pain, stiffness, difficulty turning the neck, and association with head symptoms, and occasional lightheadedness, dizziness, decreased concentration, an inability to function normally, and depression. Less common but important to be aware of are complaints of pins and needles, pain, or numbness occurring in the upper back, the shoulders, arms, or the hands. Cervicogenic headaches can be caused by repetitive or prolonged poor posture of the upper body that can overstress structures in the neck, or traumatic events such as a car accident or heavy lifting that result in more immediate effects. In addition to the patient's symptoms, physical therapists utilize objective tests and measures to aid in the diagnosis of cervicogenic headaches. These include headaches affecting predominantly one side or only one side, joint tenderness or stiffness in at least one of the upper 3 cervical segments, headache frequency of at least once a week for a period of 2 months to 10 years, poor performance of the deep neck flexor muscles. Observe how physical therapy for cervicogenic headaches involves manual therapy and directed therapeutic exercises, combined with a home program tailored to the patient's individual needs. Manual therapy involves cervical mobilization or manipulation, and therapeutic exercises target muscle control of the deep neck flexors and soft tissue flexibility. Once available mobility and adequate motion control is established, muscular endurance and strength can follow more easily. Let's also look at the risks associated with physical therapy as compared with traditional medical treatments. As you can see, the risks of serious complications from any of the treatments provided by a physical therapist are significantly lower than their medical counterparts. Multiple studies confirm improved outcomes with physical therapy care. The combination of specific manual therapy and exercise emphasis on motor control and muscular endurance of the deep neck flexors yields dramatic and long-lasting results. The best evidence available shows how physical therapy can be a first-choice option for many headache sufferers. Here we can see the difference between results from the control group and the group receiving manual therapy and exercise at 7 weeks. The comparisons even last 1 year after treatment. If we look at reduction in neck pain, the comparisons are even more striking. At 7 weeks, and now at 1 year after treatment. Physical therapy is also effective in significantly or completely eliminating cervicogenic headaches. Let's look at two different approaches to the same problem. In the traditional model, a person with cervicogenic headaches might go directly to the physician. The physician's approach may be some combination of medication and imaging. If these fail, then they may refer the patient onto physical therapy. In the new model, a person dealing with cervicogenic headaches goes straight away to the physical therapist. In both scenarios, the patient ends up at physical therapy. However, if the patient has direct access to the therapy, then the new model yields a better, faster, and less costly outcome. And the cost savings can be as high as 2/3. As you have just seen, there can be a silver lining when talking about headache treatment. Physical therapists are especially qualified to provide you with this solution. They can deliver a proven and safe alternative to drugs, cost-effective treatment saving you and the healthcare system from continued unnecessary expense, a tailored plan of care that combines manual therapy and exercise you can continue at home. Your pathway to cervicogenic headache relief may be as simple as logging on to the American Physical Therapy Association's website, www.moveforwardpt.com, and clicking on the link, Find a PT. And remember to mention this video to your physician. Perhaps they also have more patients whose headache is not all in their head.